Hi, today I'm going to be doing the blood glucose self-monitoring. A couple things before we get started is why we are doing this. We're accessing the blood glucose to control the level of it, to see the sugars. We're going to do this also to determine intervention. Although RDs can't prescribe medicine, we can also see the impact and efficacy of medication. Other things are who should do it. So people who are already diagnosed diabetic should be checking their blood sugars to see if they need to increase insulin and things like that. And people who are also pre-diabetic, and that's determined via the A1C blood level. In the video earlier, it was mentioned that the A1C is kind of like a big picture overview for the last few months, whereas blood glucose monitoring is daily, so you can see what's happening, throughout the day and how your blood sugars are affected by that. You can do this kind of whenever you would like, whatever kind of works for your lifestyle. Typically, it should be done before you're eating or like right when you wake up after you're fasting overnight. And you can also do it 2 hours after eating to see what your blood glucose is then. So I am going to get started on how to show the testing in action. So I have on my counter here, hope you can see, there we go. I have my monitor, what I'm going to use to stick, my lancet, and I have an alcohol pad. I also have the testing strip on a paper towel. I have already washed my hands, but it was a little bit ago before I started filming, so I will use the alcohol strip to make sure my finger is clean. I will also wait for a little bit to make sure that it is not wet, because that can interrupt test results. So I'm going to pick my middle finger right there. Just gonna give it a nice good clean. I also have the paper towel because you're not supposed to use the first drop of blood. So I'm going to push a little bit, clean it off, and then I'm going to use that drop of blood. So while my finger is drying, I'm going to get my needle ready. You take this little mark right here, and then there's an indented one that, oh, there, you can't see it. You twist that, push in and twist, and you should hear that, and then that will open. I have mine set at the 3, that's how it came, and that's also how I saw it in the demonstration before. I'm going to take my little needle and twist it 1/4 of the way, and then I'm going to insert it into my holder. And you heard a little click, and you can twist it the rest of the way. There you go. Perfect. We're going to close this back up again. Again, it's going to meet up with that mark, and then we twist. Okay, so I have this ready. I'm now going to insert my testing strip. This silver side will go into the meter, and then it will turn it on. You should hear it click. There we go. So now I have 3 minutes before the machine will turn off. And if that happens, you can simply take that test strip out and then put it back in, as long as it is not used. Okay, so my finger feels dry. So I'm going to take this and I'm going to push this button into my finger so it pricks it enough so I can get some blood out for my glucose binding number. Okay, so I'm going to hold this right here. Okay, just a little teeny drop. I'll wipe it away. Get some more. So there we go. I'm going to push it on there, and this strip will suck the blood in, so I don't have to keep pushing and pushing. So there we go. So now I have 5 seconds before it will read it. In that 5 seconds, now I'm going to make sure it's. So it says my blood glucose is 104. According to that, I have just recently eaten, so it is normal because it falls within the 180 to 130 range. And this is information given to us by the American Diabetes Association. So some things that could compromise my reading is the meter being old, 5 years or older. My test strip could be damaged. That can give me a different reading. Too little of blood. Luckily this meter in particular, if you don't have enough blood, it will tell you, and it's called the second chance, and then you can add more blood. And then also poor hygiene. So if I didn't wash my hands, if there was sugar on my hands from something, that could also affect it. And your hands being wet can also affect it. So if this blood glucose meter is not, you think it's not accurate, the readings aren't coming out right, you can calibrate it. The first thing you want to do though is check the date and time settings. After that, there is a control solution that has come with our kits, and you can use that to test to see if to calibrate your meter. You want to use this solution when you're checking for calibration. You do not want to use blood. Do not use blood. After looking it up online, it says that the range it should have when it's checking with the solution is 113 to 140 milligrams per deciliter. Typically, you want to repeat this often, regularly, about once a month. A lot of times a nice number to remember is when you get new test strips, just check it then. Also, if you suspect that it's not working correctly, go ahead and give it a check. And that is all I have for you today. So I hope you learned about how to check your blood glucose levels.